This morning, we take a look at a new resource molding college students to help address the growing opioid crisis.
Yeah, there's a shortage of behavioral health professionals. And as RTV6's Mark Mullins finds, community health is looking to change that.
As a dual licensed clinical social worker, Jackie Lentz has the specialized expertise needed in the state's fight against the opioid epidemic.
I mean, every day I get fueled by seeing the difference that can be made.
Her training combines social work and addiction counseling, which helps serve her patients at Community Health on a broader level, addressing their substance abuse issues and the root triggers behind them.
There are too few of us. And so, you know, I am all on board with helping anybody that would like to, you know, come in here and work with this population.
We tried all of our normal methods to hire people with signing bonuses and recruitment bonuses and things like that, but we just weren't getting the workforce. And that's when we realized the problem really isn't us. There's just not the workforce to be had.
Now, through a new endeavor called the Community Behavioral Health Academy, Community Health Network is working with UND's School of Social Work, IUPUI, and Ascend Indiana to bolster the number of clinical social workers who can address not only addiction, but also mental health at the same time.
It'll have a profound impact on what is a public health crisis in our state.
The Academy hopes offering students financial incentives and a streamlined pathway to a higher paying position will help attract people to this high-stress profession that is typically offered low salaries.
If you have to get this high amount of education, this long on-the-job kind of training experience, and then pass an exam, we want to be able to help you do that with these stipends that we're giving. So this $5,000 incentive to really come do your practicum, and then the $5,000 after you get licensed really is an incentive to try to get people into the counseling arts.
If you have a passion for working with people, that you want to be able to make a difference in people's lives, then pour your heart and soul into it, because it is well worth the investment.
Thus, more specialized social workers helping treat addicts quickly and efficiently in order to hopefully make a dent in our state's growing opioid crisis. Mark Mullins, RTV6.
Mark, thank you. Next month, Community and Ascend Indiana begin interviewing student candidates, but we won't see the payoff from this project until at least 2 years from now, when this new caliber of social workers is ready to hit the labor force.
The demand for behavioral health professionals is growing. In fact, our state needs to fill more than 7,000 positions to meet the need. If you or someone you know is interested in learning more about Community Behavioral Health Academy, we have a link posted for you. Just look for this story in the RTV6 app or click on this story at hiringhoosiers.com.